Bismillah.
Hi everyone, welcome to another Sunday Smiles. My name is Ebtihal Badawi. I am an artist. My art is expressionistic, where I use my emotion and words to guide me. Each painting is a journey process to learn about myself and about the world. I love building community, bringing people together. That's what my art about. And a couple of weeks ago, I took a theta class. Theta is one of the wave brains where we connect and we can change our belief system. And in this class, I met someone very special. Her name is Omaimah. She's with us. She's truly inspired me in every way of life. She is amazing human being, amazing soul, and she is a nurse, like she's an angel. So today we have the privilege, she is joining us, and she will tell us more about her passion. Omaimah?
Hi, everybody. Good morning. Is that for me? Okay. Hi, everybody. Can you hear me now?
Yes.
Yes. Good morning for people from Pittsburgh and good evening for people from Saudi Arabia. I'm so glad to be here. Thank you, Ibtihal, for the introduction. I appreciate it and appreciate giving me this opportunity to talk about nursing. I don't know, I can hear like an echo, but I'm not sure why.
I mute everyone. I think there was someone not muted.
Okay. Yes, so I'm glad to be here to talk about nursing. Of course, nursing is a broad topic, and I'm not going to be able to cover it all in 20 minutes, of course, apparently. But I'm going to talk about very small aspects, I would say, maybe one aspect that has more than one subcategory that we can talk about. First of all, we need to know what is nursing. Nursing is a profession that, in short, I could just say that nursing is a profession where nurses work with patients. This is a very broad definition, but it gives you it sheds a light what type of profession is nursing. So nursing is a profession that working with patients, but what makes nursing different from some other sciences that when we deal with patients as nurses, we deal with more than one aspect, which we call it a psycho-socioeconomic approach, or we call it a holistic approach, which means that we consider more than one aspect of the patient's life. Not only the health status, but also we focus on the social and the psychological and even the economical status could make an influence on the person's health status. So we focus on all of that, and that what we call a holistic approach. That's, I think, what I could say just briefly about nursing. But as I said, nursing is a broad topic that I'm not going to be able to cover it in even 2 or 3 days with all these sub sections from nursing, and the science is developing every now and then, and a lot of new aspects are added to nursing, and even definition of nursing is something dynamic, and it's ongoing changing from my perspectives. I would talk also about, especially now we're experiencing في أحاديث عن الترجمة. Is there going to be a translation, Ibtihal?
Can you try to translate?
Of course. of course serious of course. طبعا أنا أعتذر إني بديت بالإنجليزي، بس أنا اليوم راح أتكلم بطريقة جدا بسيطة جدا مبسطة جدا عن التمريض، عن علم التمريض. طبعا لأنه علم التمريض علم كبير جدا، فما راح أنا أقدر أغطي في 20 دقيقة، ولكن راح أتكلم عن الأشياء البسيطة جدا اللي تخص التمريض واللي تعتبر أساسية. قبل شوية تكلمت عن تعريف التمريض. بالنسبة لتعريف التمريض أنا راح أقول إنه العلم اللي أو المهنة اللي فيها التعامل مع المرضى. عندنا إحنا في مبدأ في التمريض بالنسبة للتعامل مع المرضى دائما نتعامل مع المرضى بطريقة شاملة، يعني بنشمل الحالة النفسية، الحالة الاجتماعية، وحتى الحالة المادية كمان بنركز فيها وإحنا نتكلم عن التمريض أو نتعامل مع المريض. فمش بس الحالة الصحية، ولكن كل العوامل اللي ممكن تأثر على صحة المريض، على صحة المريض برضو بنركز عليها. So the next point that I'm going to talk about is patients during mute. Can you mute?
Yes, I'm muting, but she's unmuting.
Okay. Maybe accidentally. Okay, now I'm going to talk about patients, especially now we are experiencing worldwide, we're experiencing the pandemic of COVID-19, and patients might be like, you know, different experience. They might experience different symptoms, different signs and symptoms, and a lot of things that might be different for every single patient. And the most thing that makes it special about COVID-19 is the isolation, and that the patients, most of the time, I would say most of the patients who have a clear symptoms of COVID-19 will be isolated for a period of time, and they're going to be away from their families, and that might affect their recovery, the process of their recovery. It might even affect their psychological status. I'm going to translate now. طبعا بما إننا دحين في فترة مرض الكورونا COVID-19، فطبعا عندنا كثير من المرضى بيمروا بتجارب مختلفة في هذه الفترة، وغالبا أو أغلب المرضى بيمروا بتجربة إنهم لازم ينعزلوا، لازم يكون في عزل، وطبعا بيكون في بعد عن أقاربهم وعن عوائلهم. وعادة الشخص أكثر الدعم سواء النفسي المادي أي نوع من أنواع الدعم عادة بياخده من أقرب الناس له اللي هم عائلته. فلما الشخص يكون منعزل في غرفة، منعزل حتى أهله ممنوع أنهم يجوا، قد يؤثر هذا الشيء على نفسيته، وهذا الشيء كمان قد يؤثر على عملية التشافي عنده، سرعة التشافي واستجابته للأدوية وهذه الأشياء، وهذه طبعا فيها أبحاث اتكلمت عن هذا الموضوع. As we know, like many studies that talked about the effect of the supports, psychological supports and the family support on facilitating in the recovery for and improving the patient's outcome. So I think most of us, if not all of us, know that. I would talk about how patients, when they go through these hard times, they need a center or like a source of power or encouragement, or I don't know, or like I would say like a system, or something that will lift them up, something that will hold them together so they can go through the recovery process smoothly, or I would say with less trauma, I would say psychological trauma. As I said, we consider most of the support will come from the families, and when families are not allowed to see the patient, when the patient is not allowed to talk with his family or her family, that might affect her. In that case, patients here need to learn how to lift themselves up, how to use or utilize the best of what they have, what's available. Their family are not around, but they might have other options that they might try. They might try meditation. Just like meditations, a lot of meditations are available online through the YouTube, and it's something that easy to find. They might do prayers, like regardless of the religion, like Muslims and non-Muslims can have some sorts of prayers that they can perform and that can spiritually lift them up. They can try reading books. They can try chatting with their loved ones through phones, through these social media, different social media methods that they can try. They can try painting. They can try even drawing. I believe sometimes people, they don't know about their potentials until they try. And sometimes if you never try to hold the pen and try to draw, you don't know that you have that potential. You don't know that you have that skill, that you can copy a picture or you can draw something that out of your mind, like just out of scratch. I think it's very important for us to teach our patients how. I know it's not always feasible, it's not always applicable. Just to be realistic, some of the patients, they will be very sick. Some of the patients, they need more help. It's not only that something they can do, but they might need professional help, like some psychological assistant or something to assess them to go through this experience. But I'm just talking about general, in general, like patients in general. We talked about, reading books, socializing. Breathing exercises help a lot unless it's contraindicated. If it's not contraindicated, then it's a very good exercise, a very good habit that patients and even like everybody else could do, and that can leave a positive effect on their lives. الآن راح أترجم تكملة. قاعدة أتكلم عن إيش الأشياء اللي ممكن المريض يسويها عشان يساعد نفسه في مرحلة المرض، خصوصا مع العزل وبعده عن الأهل وكده. هذا قد يأثر زي ما قلنا على نفسيته، لكن في عندنا أشياء بسيطة ممكن الشخص يعملها. أسامة ممكن الشخص يعملها وتساعده كثير في إنه ينتقل نفسياً وروحانياً. من الأشياء اللي إحنا ممكن نسويها اللي هي التأملات موجودة كثير على اليوتيوب. في تأملات عديدة تساعد في التشافي، تساعد في الاسترخاء، تساعد في التخلص من الطاقة السلبية. يعني في خيارات كثير موجودة في الانترنت ممكن الشخص يستخدمها. الصلاة بالنسبة لنا إحنا كمسلمين، وفي طبعاً أنواع تانية من الصلوات في الديانات الأخرى برضو ممكن الواحد يمارسها، واللي تساعده إنه يكون دائما متصل مع ذاته وتساعده في تسريع عملية التشافي. ممكن قراءة كتاب مهم، كتاب أنا من زمان مثلا مؤجلة قراءته ممكن يقرأوا. عندنا الرسم، وحتى يعني في ناس كثير عندهم مواهب كثير لكن هم ما يعرفوا عنها لأنه عمرهم ما جربوا، عمرهم ما انحطوا في الظرف إنهم هم يجربوا ويشوفوا إيش موهبتهم. فهذه قد تكون فرصة إنه الشخص يجرب ويشوف مواهبه. هذه طبعا كلها أشياء أنا أقولها إنه إحنا نستخدمها عشان نعلم المرضى عندنا. يعني إحنا إن شاء الله ما في أحد عندنا هنا من المصابين، لكن إحنا ممكن نكون من الناس اللي حنضطر أو اتعاملنا مع مرضى من هذه الفئة، فنعرف كيف إحنا ممكن نساعدهم بأقل القليل اللي موجود، ويستغلوا الظروف يعني الظروف المتاحة لهم بأفضل استغلال. Now I'm just going to talk about one example of a patient I told Ibtihal about. I have, of course, like many stories that happened during when I was working in the hospital. And I remember one patient who was a BMT, who was a bone marrow transplantation patient, and who usually they get medically, they get their immunity to be dropped to zero, so they don't have rejection when they get the transplantation, the bone marrow transplantation. So during that period of like dropping their immunity, of course, families are not allowed to visit them. They visit them only, and they can see them only through a window on the door with a phone that they can call, and the patient can answer from inside, and then they can see each other and they can communicate. I remember that patient who was always smiling, always smiling, always smiling. Even that he was like in his room for 28 days, he was not allowed to go out. But what he used to do is, because I like to make jokes, and so he used to call me on the desk when I'm working, and he knows my shift. He calls me and he asks me, please, can you come to my room with one of my colleagues? We used to go there and make jokes and laugh, and he laughs like, like he enjoys it to the max. And we used to do that. We used to do that with him whenever I'm working. We go to his room, we laugh, we chat, we watch TV together. And that patient really taught me a lesson, like taught me more than one lesson, but I learned that how, like, even though with all the circumstances that he's going through and having chemotherapy and everything and leukemia and everything, but he still had found a way of enjoying the moment, enjoying the time that he is in. Like, instead of being suffering from pain and just sitting in his room with no, that he has no family to visit. But he also tried to use this time and tried his best, and he used nurses to cheer him up, and we did a good job. Unfortunately, this patient passed away after the transplantation. Actually, it was successful transplantation, and but then he had like some kind of complications, and then he passed away. But I remember that patient very well, and he left like a legacy in me. With that attitude, he had an attitude. You always go to his room and he's smiling. He doesn't have anything like you would say, like us, you can go outside, you can buy whatever you want. He had a very specific type of food that allowed, isolation, and I think it's similar to what COVID-19 patients might experience. So I wanted just to mention that example. The last point, let me talk about this, translate this in Arabic. اتكلمت عن مثال لمريض كان عندي، مريض كان جدا جميل، وهو اسمه جميل. كان يحب الحياة بالرغم من أنه كان مريض زراعة نخاع، وطبعا كانت مناعته لازم تنزل للصفر عشان لما يزرعوا له النخاع ما يكون عنده أي مقاومة وما يكون في رفض من الجسم. مع كده، وكان طبعا معزول في غرفة، كان أبوه اللي يجي يزوره يشوفه فقط من شباك، وفي تليفون يتكلم معاه جوا بس ما يقدر يدخل له. طبعا عاش هذه الفترة 28 يوم لازم يعيشها، ومناعته قاعدة تنزل 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 إلى ما يصل للحد اللي ممكن يزرعوا له فيه النخاع. مع كده كان مبسوط، كان دايما سعيد، كان دايما مبتسم. وكان في حاجة يسويها لما أكون أنا موجودة في الدوام، هو مرة ينبسط، يكلمني على الديسك ويقول لي لو سمحتي سيستر أميمة ممكن تجي. وكان في كان في زميل لي، كنا نروح ونضحك ونجلس نتكلم معاه وكده، وكان يضحك 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 من قلبه. يعني فعلا فعلا نحس انه احنا سوينا شيء، مع انه شيء جدا يمكن يكون تافه، بس ندخل عنده نجلس ساعة، أو عادة نخلص شغلنا مع المرضى التانيين نفرغ نفسنا عشان نجلس معاه. وفعلا فعلا الإنسان هذا علمني الكثير. يعني بالرغم من إنه الظروف اللي هو فيها ما جلس واستسلم للألم، وما جلس استسلم للوضع اللي هو فيه، لا، استغل أبسط الأشياء. كان يتفرج التلفزيون وكان ينادينا عشان نجلس ونضحك معاه، وكان يضحك يضحك فعلا، يستمتع بالدقيقة والثانية. الله يرحمه، يعني هو توفى، الله يرحمه. بس كان إنسان جميل، كان إنسان جدا رائع، وعلمنا كثير من الدروس. So now I'm gonna talk about nurses, the angels. Of course, everybody perceive nurses that they are the ones that they never break down, they never feel pain, and they never give up. Unfortunately, we are just human beings, just like everybody else. We go through hard times. We get exhausted. We get tired. We get stressed out. We experience fear and anxiety, especially when working with pandemic patients or patients with communicable diseases. We go through a lot. Some of the nurses, they even sacrifice their life, and they decide to stay away from their families, so they, as a protecting method for their families from like they fear, they have the fear of transmitting the disease to their families, so they prefer to stay away from them. I think appreciation can make a difference in nurses' lives. And the appreciation is, I think, perceived differently from people. Like everybody can perceive appreciation in a different way. Some people, they might perceive just a nice words as an appreciation, like just to say thank you is an appreciation for some people, and it can encourage them to carry on even with the hardship that they go through. They might just need that nice word to hear from surrounding people, from their authorities, to push them up, to cheer them up, and support them. Some people, they might consider, as I said, thank you cards. It might be only as simple as a smile on the nurse's face. You just smile. Like if we're patients, or if we're families of patients, maybe just smiling is something, a great gift to provide to nurses. So be generous with that. Just smile, just say thank you. It means a lot to them. To us, it makes a difference, even though it's something very simple. Day off might be an option, but I don't think it's gonna be feasible with times of pandemics or something like that. It might not feasible to provide off days for nurses as an appreciation for them. Bonus could be a good idea too, but you know, when it comes to money, there are a lot of politics can play a role in that. So it's just like different options that might be helpful for nurses, and cheer them up and show them appreciation. Of course, as nurses also, we are supposed to be nice even when we are going through a lot. We still have to be nice to people. We still have to smile. We still have at least not to be, you know, difficult, especially with patients when they come and they are in pain. They go through a lot sometimes before coming to us, to the hospital. So we need to consider that. We have actually to consider that in mind, to keep that in mind when dealing with patients and their families. Of course, dealing with patients and their families is nursing. It's not only just to deal with the patients themselves, but also to work with their families and provide a lot of support sometimes to their families. الآن I'm going to translate. اتكلمت عن دور الممرضين والممرضات خصوصا في وقت الجائحة الآن. طبعا كثير من الناس يعتقدوا أنه الممرضين والممرضات هذول الأجسام الحديدية والناس التي لا تنكسر أبدا ولا تشعر بالألم ولا تشعر بأي نوع من أنواع الضغط. Sure, yes. I can finish in 8 minutes. Thank you. ولكن الحقيقة إنه الممرضين والممرضات هذول بشر ويحتاجوا الدعم، يحتاج أبسط الأشياء. قد تكون أحيانا كلمات بسيطة جميلة، كلمة شكرا قد تعني الكثير للممرضة. نحاول قدر الإمكان إنه إحنا نكون نايس معاهم، لأنه إحنا ما نعرف إيش اللي هم قاعدين يقاسوه ويعانوه. بعضهم ضحوا يعني حتى براحتهم، وفضلوا إنهم يعيشوا بعيد عن أهلهم عشان خايفين إنهم هم ينقلوا لهم المرض. ففي كثير من الخوف، في كثير من القلق، في كثير من التوتر بيمروا فيه. فالتقدير بأبسط الأشياء زي الكلمات الجميلة، الكلمات البسيطة، كلمة شكرا تعني الكثير. كرت أكتب عليه شكرا. أحيانا مجرد الابتسامة أرخص حاجة وأبلغ حاجة وليها أثر فظيع على النفس، اللي هي الابتسامة. فقط ابتسم في وجه الشخص، سواء كنت أنا ممرضة أو سواء كنت مريضة. أبتسم للممرضة والممرضة تبتسم للمريض، تعني الكثير وتعطي كثير من الدعم، كثير من الدعم اللي الشخص ما يتخيله ممكن. بعض الخيارات ممكن تكون طبعا إضافة بعض العلاوات، ولكن هذه طبعا لها سياسات أخرى ما راح أتكلم عنها، ولكن هي أحد الخيارات. ممكن تكون أحد الخيارات كمان مجرد إنه أنا مثلا أعطي يوم أوف للشخص يعني، ولكن أحيانا هذا الشيء برضو ما راح يكون سهل تطبيقه في الحياة الواقعية بوضع الجائحة ووضع الضغط اللي صاير وكذا. فممكن ما يكون شيء إنه منطقي وواقعي إنه ممكن يتطبق. تقريبا هذا اللي عندي. أتمنى إنه يعني أضفت معلومة أو معلومات لكم.
طبعا أكيد، ربي يسعدك. مرة شكرا يا أميمة، مرة. Thank you so much.
I hope I added some important information for you guys about nurses. Thank you.
Thank you so much, guys. If you want to have any questions, we can have like less than 1 minute to have questions so we can do the exercise. Melissa, everyone?
She actually answered the question I was going to ask, so we're good.
She's awesome.
She was reading my mind. I love it.
This is what I'm trying to improve my skills at. Reading minds.
You are getting there. You are getting there. ما شاء الله ما شاء الله. جاوبت على كل الأسئلة. دحين so everyone, we will do some art exercise. جميعا نبغى نسوي تمرين فني. So before we start, I want everyone to stand up. قبل لما نبدأ أبغاكم كلكم توقفوا. And we'll take a deep breath. ناخد نفس عميق. We raise our hands up. ناخد نفس عميق ونحط يدنا فوق. Okay? So let's take a deep breath in. Inhale, استنشاق. Out. Again. Out. They say when you put your hands up, the hormone of happiness, it works better. So more. Let's take another one. And I want you to hug yourself. أحضنوا نفسكم. Big hug. And thank yourself. Okay? On the other side, let's thank ourselves. And then let's get a piece of paper. نجيب ورقة. And we'll start the art exercise. So I want us today to activate the power of love. We will هنبدأ نفعل طاقة الحب لذاتنا. Activate the power of love to ourselves. Self-love is very important for us to go on in life. الحب للذات يشجعنا إنه نقدر نكمل حياتنا اليومية. So today we'll write our name on a piece of paper. اليوم حنكتب اسمنا على ورقة. And we will color it, decorate it, any color you feel it. It come to you, it talk to you. So just decorate the page with colors, hearts, flowers, anything that come to your mind, come to your heart. حنكتب اسمنا وحنرسم نلون مثلا ايش حاسين، ايش اللون اللي يتكلم معانا. حنرسم قلوب، نرسم ورود، ايه اللي انتوا تحسوا فيه. فعندنا دقيقتين نبدأ ناخد نفس ونقول لنفسنا إنه إحنا نحب نفسنا. So during this exercise, we will do self-talk. We will say to ourselves, we love you. I mean, I love me, and everyone love themselves. So you will say that I love you, I love me, I love me, I love me. So everyone continue saying this during this exercise. So أباكم كلكم لما أنتوا تعملوا التمرين تقولوا لنفسكم أنا أحبك نفسي، شكرا ليكي، وتقعدوا تتكلموا مع نفسكم عشان نرفع طاقة حبنا لذاتنا. So we wanna increase our self-love. Let's start. Take a deep breath and continue talking to yourself. ناخد نفس عميق ونبدأ نستمر في إننا نتكلم مع نفسنا. I love me, I love me, أحبك يا نفسي، أحبك يا نفسي, I love me, I love me. And everyone, you can share a picture of this exercise to our email sunday.smiles@hotmail.com. And also we have our Instagram page sunday.smiles25 at Instagram. So جميعا تقدروا تشاركونا برسماتكم الجميلة وحبكم لذاتكم على الإيميل sundaysmiles@hotmail.com ولا sunday ممكن كمان عن طريق انستغرام sunday.smiles25 at Instagram. I'm gonna write it down. So شكرا أميمة. Thank you everyone for joining us. This is my stuff.
شكرا لكل اللي جاء. أنا يعني ما أدري رسمة كذا وردة بس لسه ما خلصتها.
مرة حلوة. أقعد وأرسم عشان الميتنج حيخلص بعد شوية بس أنا حقعد أكتب الإيميل.
Okay, nice. I would love to see everybody's paintings or drawings.
And thank you to all